Bum bum bum! Da-da-da.
Hello. Today we bring you this very special report on the growing provenance of sexually transmitted infections in our nation. My name is Samuel.
And my name is Ross. Let's just jump into the nitty-gritty of things, shall we, Samuel?
Let's do it.
STIs for short are infectious diseases that are spread through sexual contact with the penis, vagina, anus, mouth, or other sexual fluids of an infected person. Mucosal tissues in the genitals, rectum, and mouth are especially susceptible to these bacteria and viruses that cause the STIs. So, can you tell us a little bit more about the STIs themselves, Sam? And how they're caused?
No problem. Sexually transmitted infections, or STIs, as we've already discussed, can be caused by bacterial, viral, parasitic, protozoan infections. These may be spread through sexual contact, skin to skin, blood or blood products, body fluids, or from mother to baby during the labor process. All STIs have an incubation period that is the time from their initial infection to the time that the symptoms first appear.
Interesting. Now we're going to cut to Tori in the field for some more information on clinical manifestations or signs and symptoms. Tori?
STIs come along with many different manifestations. Most of the time, they can be asymptomatic, but when they do become symptomatic, some symptoms include pain or burning during urination, discharge, redness and swelling, vaginal itching, foul-smelling odors, painful bumps or lesions, penile discharge, pain with intercourse. There can be spotting, mucoid or purulent discharge, and even in women, menstrual irregularities.
Thank you, Tori. That was very informative.
Now we're going to go over to Jen for geographical prevalence and risk factors, and then shortly after that we're going to go over to Morgan for diagnostics.
People that live in an urban area or travel internationally have a higher rate of transmission and infection. Some risk factors include if you're a woman, if you're under the age of 25, African Americans, men that have sex with men, and victims of sexual assault. Some other risk factors include new or having multiple partners, sharing needles, alcohol and drug abuse, the incorrect or inconsistent use of condoms, not being vaccinated for STIs that have vaccinations, and having one STI can lead and make you more susceptible to a second STI.
So for the diagnostic testing, first we're going to do a full health history and physical exam. It could also include doing an NAAT test, which is a nucleic acid amplification test, which is just a swab test. So your doctor will take a swab of your secretions from your genitals and do a test to see if there's any bacteria on it or any viruses detected. We can also do a gram stain test, which is also just testing for bacteria under a microscope. A culture test, which again is getting a culture of your secretions and testing it for any bacteria or viruses. And they will notify you if it's positive or negative, and then you will get some treatments based on that.
Wow, thank you so much, Morgan. It really is nice to have an expert in the field here with us today in the studio to discuss sexually transmitted infections.
And now we're going to talk about what can happen to you if you get these STIs, also known as complications. Starting off with infertility,
Damage to surrounding structures,
pain,
pregnancy problems,
reproductive problems and complications,
genital inflammation.
and long-term diseases.
Well, now we're going to go talk with a local student from the Houston Baptist University, and she's going to be talking about the relevance of sexually transmitted infections at her campus. Over to you, Tori.
Adolescents and young adults and people younger than 25 make up the majority of the HBU community. Once you get into college, it is a place for increased freedom in every aspect of your life, even in your sexual freedom. Inconsistent or incorrect use of barrier methods, such as condoms, and ineffective education on how hormone contraceptives provide no barrier against STIs are very relevant and important in the HBU community.
Wow, that was some great information from our local college student, Miss Tori.
Now, back to our expert in the field, Morgan, for some more information on how to treat these sexually transmitted infections.
So whenever you get treated for an STI, the goal of the treatment is to understand the mode of transmission, complete the treatment and the follow-up appointments, abstain from intercourse until the infection is resolved, and have knowledge of safe sex practices so you do not get an STI again. So most of the STIs you're treatable with one treatment antibiotic. These antibiotics could include azithromycin, doxycycline, and ceftriaxone. There are a couple STIs that you will not be able to get rid of if you come in contact with them, and those STIs are treated with antiviral medication. In order to be sure that you've gotten rid of your STI, you will need to go back in for follow-up exams, and they will check you again and make sure you are negative. You should abstain from having any sexual intercourse or sexual activities until it is positive that you do not have the STI anymore, because you can easily just pass it back and forth between you and your partner.
Thank you, Morgan.
Well, now we're going to go back over to Jen to talk about ways and strategies you can use to prevent yourself from contracting an STI.
Ways to prevent and protect yourself from contracting an STI include abstinence, that is refraining from any type of sexual intercourse, going frequently for checkups and examination, using condoms correctly, and every time that you have sexual intercourse is a way to promote safe sex practice, having knowledge about the mode of transmission of the infection and early signs and symptoms so you can get into your doctor as early as possible to receive treatment.
Thank you, Jen. She's right. We could all use some safe sex practices in our own relationships. That would really help cut down on the prevalence of STIs in the country. Don't you think, Ross?
Ain't that the truth, Sam? Wow, with such a great prevalence, shouldn't the financial burden on this country be huge?
You're right, Ross. In many cases, STIs can be treated with a single dose, but in many others, treatment is required multiple times and can be very costly to the individual.
Oh, I'm hearing from the facts department right now that, according to the CDC, STIs cost the American healthcare system $16 billion every year in
Wow.
costs.
What an astronomical number. Well, now we're going to go back over to Jen, and we're going to be talking about the long-term care for STIs. Jen?
There's limited care provided in facilities. There's an increased need to provide care in nursing homes because as generations age that are diagnosed with an STI, they will be in need of long-term care to be provided. You will also need frequent physical exams and proper use of condoms during intercourse to promote safe sex practices long-term with each and every partner.
That was some excellent information that Jen just gave us. Thank you so much for your time.
And now back to Tori with how these STIs can affect you both spiritually and emotionally. Tori?
STIs come along with a variety of emotions. These emotions can include shame, guilt, anger, and a desire for vengeance. STIs can cause relationship issues and problems if one partner is diagnosed with an STI and the other isn't. This can result from an outside affair, and if you are in this situation or have these feelings, counseling may be needed. Participants believing spirituality helps coping with side effects reported significantly better adherence to treatment and fewer side effects and symptoms.
Wow, Sam, she made some very good points, didn't she?
She definitely did. Well, now we're going to go out to Morgan in the field, and she's going to be discussing some support resources both locally and nationally that we can all use. Morgan, are you there?
So if you do find yourself diagnosed with an STI, there are many support resources available to you right here around in the Houston area. One of them includes Planned Parenthood, which is a free clinic that can help get you treatments for your STIs, help give you testing to see if you have any STIs. There's also a place called The Source for Women, where women can go for the same thing, get treatments for STIs, get tested for STIs, and they're able to help you out with whatever you need. There's also some screening programs available. Educational programs are available for high-risk populations. But the biggest thing is that access to high-quality healthcare is very essential for early detection, treatment, and behavior change counseling for STDs. Groups with the highest rates of STDs are often the same groups for whom access to or use of healthcare services is most limited. So we need to be sure that we can let people know in our community about these resources so they can be tested and treated if that's the case.
Thank you, Morgan. Wow, isn't it great that we have such awesome resources so close to home?
It is. It's great that they're so accessible to all of us. Well, that concludes our program for today. I hope you guys all found some informative information in our presentation on sexually transmitted
I know I
infections.
sure did. Now, thanks from the whole crew here at KRBCHBUnews.com.
Thank you for watching.